Right now on Rising, the number of kids with peanut allergies more than tripled between the years of 1997 and 2008. That according to foodallergy.org.
It's a life-threatening allergy that forces people to be extra careful whenever they eat. But Terrence, a local team of researchers from NC State have new hope for these kids now.
That's right. In fact, this is very interesting research. Ann Lila and Nathalie Plundrich with NC State University's Plants for Human Health Institute are out of Kannapolis joined me this morning. They're actually working on developing a fruit-infused peanut flour. They're going to join me this morning to talk more about this. And this is such an interesting idea, ladies. First of all, this is obviously a major issue and has become. How did you guys decide that flour was how you go about trying to deal with this allergy issue?
Well, there's just a natural binding affinity between certain fruits or herbs and proteins, in general, proteins. And we knew that the proteins in the peanut are what's allergenic. So we thought if we can make a binding, a natural binding to those proteins and change them or mask them somehow so that the body wouldn't recognize the peanut as a foreign object, we could prevent the kind of symptoms that people go through with peanut allergy.
Now, for practical use, how does this really work?
Well, this right now is what we're working on is supposed to be a less allergenic peanut ingredient, can be used in oral immunotherapy. So they already use, it's a very promising therapy approach for peanut allergic patients. And they give small amounts of peanut flour, especially to children, over a long period of time, and in order to desensitize them to peanuts. So if down the road they ingest something, they don't react like heavily to.
And fundamentally, that is the idea. You kind of back your child away from the allergy.
Yes, you don't prevent the allergy, but you do prevent that horrible sensitized shock that they might have by a chance ingestion of a peanut.
Now, I'm looking here at these various flowers that you've brought, and I see this pink one here and a couple of different colors. Explain what I'm looking at. I don't want to assume here.
So this is what's usually used in oral immunotherapy. A clinician will give tiny amounts to a child to build up this desensitization.
Now, do you increase the amount as the desensitization?
Yes.
All right.
But there's still that chance of shock, right? There's still that chance that the child's going to react badly, and many children have to drop out of the therapy because it becomes too much for them. Well, what we do in this case is we've modified these pre-roasted peanut flours with cranberry juice, so that's why this one's red, with green tea, with cinnamon in this case. And it's natural, it's kitchen counter kind of operation, and it actually masks the protein so that
you're fine.
Sorry. So that when the child is, well, we haven't done it in humans yet. We've done it in animals. But when the body reacts to that peanut flour, they don't sense it as a foreign object.
You know, this is obviously science, and we're talking about lots of research that's being done, but it seems fairly common sense when you really break it down. How quickly do you guys expect to actually start testing this on humans?
That's all a matter of funding.
That is the question.
Yes, exactly. And federal funding right now is really, really tough in the United States. We're hoping for the best. The preliminary results are very exciting. We want to go forward. We're looking for that funding opportunity.
All right. Can even the public help?
We hope so.
And how?
Simply by those organizations that are parents concerned with their children with allergies. There are those organizations that perhaps have resources to pull in funding.
All right. We appreciate your time, ladies. Continued success there. Hopefully you get the funding you need, and hopefully this will be something that's very commonplace.